All right, we're back. Just left the office with the CBD number 5 strip here, and then also with my spine out here on table number 2. It's been a very, very popular one here. We actually use it a lot more. Why is that so funny? Come on now. Table 2 is awesome. It's the middle child. It's the hard worker. Lots and lots of folks have been seen on this table here in the last couple weeks. So if you are just tuning in and you didn't see our former video, we did a review, product review of the CBD stick and also our Isagenix protein. So if you didn't see that one, it's a couple minutes long. If you are interested in CBD, you want to go ahead and check out that video. The reason I'm bringing it out here too is to show you how it applies and basically the type of things that you want to use CBD for. This specifically ties in with our second video here, which is going to be talking about why people are seen for low back pain. Following up from last week, 80% of adults will experience some form of low back pain at some point in their life. For many of our younger people, insidious onset or our back pain that you don't know where it came from, it's just been nagging at you, is going to be more here at the bottom of the thoracic. The second one that I want to talk about, which is involved with too much sitting, so sedentary. So if you haven't been to a chiropractor before or you haven't seen your favorite chiropractor in some time, this area right down in here is another specific area that is triggered to be set off. And a lot of that comes from, and they conveniently put the disc bulge here on our model there for a reason. It's because the spinal cord ends at L2, and that's called cauda equina. So there's a specialty form of nerves that comes down in here that's associated with bowel, bladder, and lower organ function and control. Okay, autonomic things that people would go to a medical doctor for to get medication for, but actually can be improved upon with chiropractic if it's caught within a time frame where conservative management could actually help you. Okay, so when you're seated, there's this thing in a lordosis, which is a cervical spine and a lumbar spine, as we've talked about before, called the arc of life. My first mentor called it that, the arc of life. And so every piece in here is supposed to be spread out in a certain way. So when you're seated and your posture is good, your low back is going to bear the weight of your body appropriately. When you start to be seated like this and you bend forward and you get kind of slumpy, poor posture, right? Or a lot of driving, or maybe you just have a subluxation in there that hasn't been detected yet, you start to lose this curvature and it goes forward. And when that arc of life gets straightened out, the pain travels from the mid-back down to the lumbar spine, and that's when it starts to cause problems. So people will have low back pain right in the middle, and they'll start to get a lot of back bracing. So when people are not being seen, that's what your CBD is for. If you're currently unable to see your chiropractor and you have had low back pain and this sounds like you, and some of us folks know who we are, you just want to pop the top off your CBD stick, rub it right on. It's going to go right along. You're going to be able to feel the bones right in your spine. You're going to go to the side where some of those really tough muscles are. Take your CBD, get plugged in, rub it on there, and it's going to give you a certain number of hours of relief, or it's going to take the edge off the pain as well. CBD actually, as most of us know, we talked about before, is THC free, so this is completely safe to use. So whenever you start to develop low back pain due to instability, this is the long-term changes. Okay, so this is a short-term. This is going to be helpful and supportive, but it is not going to be corrective. This is adding or helping you get to a place where you're going to be suffering a little bit less before you can actually get in to get your chiropractic treatment. Your chiropractic treatment with a corrective care doctor, which is what we do here, is designed to help repair the curvature and place it back, okay? And my favorite way to do that is with my drop piece tables here. That's why I call these my children and my workhorses, because they really do save the quality of people's lives and help give you your energy back so that you're not focused on how much low back pain you're in. Remember, 2/3 of your body weight is being bore right down in here. So if you compromise the facets in your lumbar spine and take them out and you can no longer bear weight appropriately, you're going to end up with possible nerve damage, degeneration in that area, facet grinding, so you hear some clicking and popping, and when you go to step up and you're kind of doing this to help lift yourself up because it's harder to get up and it's not your hips or your knees, you know it's your low back. Give yourself 10 years without care and correction, it'll get to your knees, okay? So that's why we do these videos. That's why we're trying to help people understand biomechanically what happens at T12, which causes low back pain, which can become a long-term situation for you. Instability, undetected subluxation. Furthermore, L3, instability, undetected subluxation. That changes the way your body functions. And if your posture's poor and you no longer have quality integrity in those bones, you're going to be suffering, and you could potentially be suffering for a long time. Okay? So with that, that is the main message I wanted everybody to have today. Next week, go ahead and tune in again. We may do another product unboxing. I'm not sure yet. It depends on what it is that we might need in that time frame. And then we're going to finish up next week as a preview with L5, sacrum, and then hip issues that are also main culprits with low back pain. We're going to be talking about the types of people who suffer from that as well. Until then, stay safe. If you need CBD, give us a call, 952-892-5006, and we'll see you next week. Thanks for tuning in. Bye.